Good afternoon, ladies and gentlemen. Thank you for inviting me to moderate this discussion. I think that's the very good moment to talk about the challenges related to climate protection, as well as the changes which are necessary in the context of public health. We refer to the changes in power engineering. Never in history, human health has not been exposed to so many dangers as it is now. I would like to introduce our panelists. I would like to welcome Adam Guibourgé-Czetwertyński, Undersecretary of State. I would like to welcome Pascal Canfin, the member of the European Parliament. Mr. Canfin is active in the area of climate and environmental protection, as well as in activities related to the European Green Deal. I would like to welcome Ms. Anne Stauffer, who is the Director for Strategy and Campaigns at HIL, and Professor Tadeusz Zielonka, who represents the Doctors for Clean Air Coalition. Professor Zielonka is the president of the coalition. His opinion is very important and can be of supreme importance for future activities in the field in Poland. I am Justyna Piszczatowska. I represent green-news.pl, which is devoted to environmental protection and to the issues that companies, organizations, and countries can do to protect the environment and the climate. Our discussion today focuses on the climate and energy policy. I would like to begin our discussion with describing the state of the operations, the status quo in Poland. Now, I would like to ask the Minister to present the major aspects of the climate and energy policy for Poland, which was published by the Ministry in September. Yes, with pleasure. I think this is an excellent approach to our debate because different aspects related to health, to environment, as well as our energy transformations are interrelated. In Poland, the quality of air is really bad, and although it has been improving recently as a result of such programs as the Clean Air, there is still much to do in this area. The policy which we have developed in the Ministry for Climate and Environmental Protection as one of the pillars includes the issues related to the improvement of air quality. Other pillars of the energy policy include ensuring fair transformation for coal-based areas, development of new jobs in the areas struck most by the negative consequences of the climate policy. Furthermore, creating a zero-emission energy system that will be based on renewable energy sources and nuclear energy to ensure the stability of the system. Whereas the third pillar is the one which I started with, namely the improvement of air quality, which we want to achieve through activities related to transport. In this respect, we would like to have zero-emission public transport systems by 2030. Recently, we have started support programs within the National Environmental Protection Fund to support local governments to buy new means of transport. As for transport, I would also like to mention activities aimed towards limiting the emissions related to heating of buildings through connecting a greater number of buildings to the heat distribution network, as well as we would like to provide connection to alternative clean sources such as heat pumps or gas heating network to enable switching to other energy sources which which are less polluting the environment in order to reach the objectives by 2030. The objectives include not using coal in households in Poland to heat the households. That's just a brief presentation of the policy, but I would like to answer your questions in detail later on. Thank you. The current question, which I want to ask, is related to the report presented recently by the Environmental Protection. It states that unfortunately the quality of the air we breathe has not improved significantly, or we should not say it has not improved at all. Could you give some introductory information telling when we can expect some results of the policy? We have already seen some effects, some results, but there is still a long way to go before we reach the situation which is satisfactory for us. However, according to the report developed by the Inspectorate for Environmental Protection, last year, namely when the effects related to the pandemic were not included, and we simply were limited to the clean air policy effects, that the number of zones in Poland where the levels were exceeded for the main air pollutants was reduced by half for the major pollutants such as dust. So there are still many zones where the emission levels are high. However, we can see some results of our activities. Furthermore, they can be observed owing to the number of projects implemented as part of the Clean Air program, which enable the Poles to switch to cleaner energy sources. These energy sources are used for heating the households and would like to continue the programs in the future. Thank you very much. Now I would like to give the floor to Pascal Canfin. Could you please, yes, switch on your mic. Yes, now it's on.
It's on.
Panie Canfin, wiemy, że jest pan, jeżeli chodzi o
Mr. Canfin, we know that as far as the activity in Brussels is concerned, you are among the leaders of those who deal with preventing climate changes, and you know the situation in Poland very well. How could you assess or refer to the Polish plans related to energy and climate?
Well, thank you. I'm happy to be part of this conversation. As you said, I wouldn't say that I know the Polish situation very well, because you know it very well. I know it maybe quite well, but not very well. But it was important for me and to dedicate my first trip, I would say, from Brussels to a capital to Warsaw and to Poland when I was nominated as chair of the Environment and Public Health and Food Safety Committee in the Parliament. This committee is now the largest committee in the Parliament, which means that from the European Parliament perspective, the Green Deal transition is one of the key top priorities for our mandate. And it was very important for me to go first to Warsaw because I know that it's a hot topic in your country, and the discussions between Poland and the European Union on this topic are key to deliver our European objectives. So that's why I consider that it is my role to be part of that kind of conversation, and I have regular discussion with the Polish government, and I say hello to Adam here precisely to trying to bridge the gaps that might still exist. So I'm not going to assess into the details the Polish plan, but what is interesting is that now there seems to be a move to in the same direction, and precisely what you said about coal, meaning that now there is no questioning anymore on the landing zone regarding the energy system that has to be decarbonized, meaning progressively phasing out of coal. The question is, what is the right reason to be complying with the European objective, and what are the technologies? When it comes to the technologies, it's important to recall, and I do it again, that the energy mix is fully in the hands of member states. So if a member state wants to have nuclear, it can. If it does not want, it can. If he wants to have gas, it can. If it does not want to have gas as a bridging technology, it can. The only thing you have to have is something which is consistent with the European targets. And when I mentioned the targets, it's of course the new 2050 targets, meaning climate neutrality, and the 2030 target. And we probably all know that in 2 weeks' time, there will be a decisive European Council on this topic to set up what we expect as at least 55% as the European objective for 2030. And I do hope that Poland will be on board and will not try to veto this objective, because that would be counterproductive for everybody. And the last message, and I will back to you, the last message is about the just transition. We are setting new targets. We give the member states what they want in terms of sovereignty to choose the energy mix which is compatible with these new targets. Of course, if the energy mix is not compatible with the targets, it becomes a European problem. But as long as the energy mix is compatible with the targets, it's fair. But then when we need to have a European added value is on the just transition. And we said, and it's widely supported across the board in the Parliament and in Europe, is that we will not leave anyone behind. So we will provide additional financial support, and it is through the Just Transition Fund, but beyond this as well, we will provide additional support to the regions, the workers, the people, the categories in the societies, namely the Polish society, but not only, of course, that needs more support to move from a situation which is not compatible with climate neutrality and a situation where it will be compatible with climate neutrality. We are fully aware of the challenges. That's why we will provide additional financial support.
Bardzo dziękuję. Chciałabym...
Thank you very much indeed, sir. At the same time, I'd like to use this opportunity and tell you especially to those who are watching our discussion. At the end of the session, you may pose your questions. There'll be Q&A time, and the panelists will be ready to take up 2 or 3 questions. How do you pose questions? There is a chat window that you need to use at the bottom of the screen of the application that we are using at the moment. You can pin in your question. Question to Anna Stauffer. What is your opinion about Poland's plans regarding its energy and climate? And you'll be speaking from the point of view of this NGO organization you represent. In your opinion, can you give us a broader perspective of the problem? How Poland, with regards to the actions now and in the future, how are we ranked when compared to other European Union member states?
Thank you very much for the question, and a pleasure to be part of this conversation. And before I go deeper into some of the issues raised here on just transition or the pace of decarbonization, I wanted to start with a bit of a different message. And this is a message that we've seen from our organization as we've worked on air quality and climate issues for over a decade now, and looked at the health consequences, and have also seen that the health sector ourselves have become more and more concerned and actually engaged on these issues. And that is the clear message on the urgency to act. This is very clear from the science, but it's also becoming more and more clear when we are serious and true about protecting the people's health, and especially those that are most vulnerable. And what I mean with from the science, I think it's pretty clear to everyone the data that is out there, that last year in Europe was the hottest year on record. For this year, we already have seen the hottest months, January to September. Since 2011, of the 12 hottest years have occurred. So I think there's a clear development here and a clear acceleration. And these kind of, the global warming that is happening at a worrisome pace actually brings with it, lots of health threats, includes the increased frequency and also the increased intensity of severe extreme weather events, including heat waves, including floods, including droughts, but also what we're seeing in terms of a prolonged allergy season, for example, that it's hard to have any time off if you're allergic, from any month between your season starts again. We've seen the spread of new vector-borne diseases this year and last year. Everyone was talking about the ticks, the new ticks that are coming in. That we've seen lots more ticks, and we have a lot of health challenges that we need to address. And what is clear that in all these discussions on how we respond to that, we're running out of time. We don't have ample time. It's a very good step that we have the commitment to climate neutrality for 2050, but 2050 is a long way away, and it's actually our actions that will happen in the next decades will be key, because at a certain moment, it'll be really hard, and it also be a lot more costly to do actions instead of taking action now. And it's really the transformation needs to happen. It was mentioned before, we'll have a key European heads of states meeting in 2 weeks' time. We'll also see, in 2 weeks' time, the commemoration of 5 years of the landmark Paris Agreement, where we had the agreement by governments around the world really to limit global warming well below 2 degrees, if possible 1.5. And we really need to set the path now on actually being able to stick to the Paris Agreement for all of our health. Thank you.
Czy można jednak, chciałabym dopytać.
So I'd like to add on, Anna. So can we say today that plans of Poland and actions of Poland, do they diverge in a negative way from other countries of the European Union?
Again, it's about I would say it's more general about recognizing where we are and what is the pace that we need to see change happening. So it's very good. I'm talking now about the EU goal that has been set in terms of reducing CO2 emissions for 2030. We had previously had the goal of -40%. Then the science was very clear that this is definitely not enough. There's now a proposal on the table to raise that to -55%, which is a necessary step forward. But actually, the science has even advanced now, and also what we're seeing from the health side, we see that it should be at least -65%, as I mentioned, in order to keep the goal of the Paris Agreement. And I also want to mention here, I mean, from a health perspective, why are we doing this action? We talk a lot about the ice melting and the polar bears, but ultimately the measures that we're taking for climate mitigation and also in the energy sector, this is very much about a health, and this is about protecting those that are very vulnerable. We're doing with the pandemic times, we're taking a lot of very comprehensive measures to protect the elderly. Now, when you look at how the elderly are actually at risk from climate change, we face a huge risk. Europe, is one of the oldest, or is the region with the oldest population in the world. I think it's about 42% of our population is over 65, and we have seen the numbers already. How the heat waves of the past years have impacted the elderly and have caused more heat stress and actually more people dying from heat. And I think this is, with this recognition, this should be the basis on judging the actions that we're taking.
Dziękuję.
Thank you very much. Professor, it goes to Professor Zielonka. You set up Poland's first, as far as I remember, the only in Poland, and a very important organization. This organization brings together medical aspects and looks into impact on social health, general public health. Can you give us some facts and figures which make it possible for us to understand how climate changes in Poland impact the general public's health? Let me start by saying that health problem was poorly marked in Polish general discourse. The debate that we have just started, we speak about Poland, we speak about climate changes, but not even once have we used the word health until people from NGOs had their say. I was listening to two political speeches. Central government and European Parliament are represented here, and the word health was not used even once. But this is a deeper problem. When creating my coalition, I was fully aware that medical milieus, professional medical milieus, do not inform the central government body with the right information. There is a specific weakness on the medical milieus side. These medical environments do not spread the news, do not give the clear health-related signals, do not indicate the central government saying how important problem on a national scale it is. It is quite typical. Look at the air pollution problem. In Poland, there is grassroots movement, NGOs that are the whistleblowers supported by the media. It is not the science milieu. When we speak about tobacco, it was not the NGO, it was the clear message from the scientific milieu. Tobacco smoking is bad for your health. But when speaking about coal and the results of coal-fired energy, medical societies have not had their say. When I read the opinions, especially the opinions related to health, this is more often professors and scientists from technical universities, engineers, rather than doctors. This is the result of a huge education gap, core education and postgraduate education. At Katowice Climate Summit, there was a conference on health problems. And I said, this is the medical milieu that is responsible for this poor air quality and for very slow mitigation against climate change, because they do not make the decision maker, the society, aware how important the problem is, not to mention the media that should be made aware. Speaking about the activities that the government has started, there's a very important question. If there is the clean air program that has been launched, so have they started the analysis of health impact of this problem? If there is an intervention, it is worth wondering what kind of results are brought about. Not only should we speak about economy and costs, we should speak about benefits it brings about. So when we start up a program and we sponsor it with big amounts of money that have to improve the climate and air quality, at the same time, it is required to launch a program that monitors health outcomes. Why is it so important? Is our situation improving? Is it the same, or is it deteriorating? We are discussing this in a debate. I've heard three voices. I can observe diversification. Krakow or Katowice are excellent examples. Over 8 years, the concentration was limited by 16 micrograms over 8-year periods in Katowice. 1 microgram in a cubic meter, up or down, increases or decreases life by 1 month. So we can say that it took Katowice 8 years to lower by 16 micrograms of air pollution in the city. So every inhabitant will be living 1.5 years longer per capita on average. This is a very important achievement that needs boasting, that needs praising. Not only have they decreased because it doesn't bring any specific information. When you say your life will be longer, it's more important to say, why is it so important? Those who have not limited this index or even increased the air pollution, in the debate, we haven't seen that Krakow, the example of the least clean city, decreases the pollution in the air. At the same time, there is not well thought policy of city development in Wrocław, and they increased the air pollution. Sometimes we may be proud of our achievements, yet at the same time there are negligences or wrong decisions which make the situation not better or even deteriorated. Therefore, it is very important to monitor the health results of the interventions, because these interventions might justify the significance of the actions, especially for the decision makers. It is very important to convince the cities, the regions, the people, because if there is the clean air program in place that refunds boilers exchange, and there are places where the money was utilized very quickly, and there are places like Warsaw, just a fraction of the money was used. This means that the general public of Warsaw does not recognize the problem. They don't know how important it is for their life and health. Not only should we show that somebody has achieved it, we should show the tangible results they have achieved. Hardly do we realize that if there is a smog alarm in the city, just like the case of Katowice, there is 27% increase of cardiac arrests in these cities. So if we decrease the amount of pollution in the air, rarer will we hear the signal of emergency ambulances transporting the ill. It translates into your life. In 30 years' time, we might be climate neutral, you can say. But look and see at the air pollution state at the moment. There are 50,000 deaths of Poles. This means 1.5 million people dead over 30 years' time. So if we delay the process in time, it's not the question of patience. You need to realize how many people will have died because we are so slow to act. We don't have it in our debate. It's not a question of a year or 2 decades or 2 decades. This means 50,000 people dead a year. A very important problem that we haven't had in the Polish debate relates to the record-breaking level of benzo appearance. There is no other country in Europe that has benzo appearance concentration at this level. This is the record-breaking level, 2 digits after the decimal point. WHO informs clearly this concentration, we don't know how it impacts your health because the tests were carried out in the countries with 100 times less concentration. We know that this is a very strong carcinogen that causes cancers. What's the impact? This concentration is 100 times bigger than the one tested. This is one of the most alarming problems. CO2, NOx's. Poland does not diverge here from other countries in CE, but we should assign very ambitious goals. There are no other countries in Europe, not only in European Union, that has got this big concentration of benzopyrene. So what to do with the benzopyrene concentration and health outcomes? This is surprising. This is what we need to speak about day in, day out. Do our decisions contribute to limitation of benzopyrene in the air, bearing in mind the levels that we have? Only recently have we had smoke alarms in Warsaw. 1 nanogram per cubic meter is the standard. And Warsaw exceeded 1,000 times over the top level, top threshold. Remember one more thing that has not been highlighted in our debates. The levels below the allowable ones are also bad for the health. It doesn't start with the exceedance of the level, but this is a linear one, the greater concentration, the greater impact. But if we have the upper limit that is exceeded in Poland, if we are just below, it does not mean that this is of no importance for your health. It is also bad for your health. Thank you very much for this quite strong but calling for action opinion. Being myself a journalist, I can say there is the education gap that you were speaking about. I can say that there is media gap or communication gap, because this is not only the question of doctors or scientists who are not aware enough of the climate changes and impact on the health. Media seems to underestimate the problem because it shows the room to act for us, for all of us. Thank you very much. And now the second round of questions in our discussion. Let us talk about the main impediments, problems, just transformation. Why doesn't just transformation does not translate into any specific actions, taking into consideration the size of our country, the whole of our country? So the first question goes again to Mr. Minister. I know that this is quite a difficult question, but this is the only question that you can ask. If the situation is as described by Professor MD, if the knowledge about smog and air pollution and their impact on people's health is there, people know that, why at the same time we have Polish government perceived as the one that stops the action at the European Union arena? Why hasn't Poland confirmed its willingness to be in line with this climate neutrality stream by 2050? Because officially we haven't done it yet. Although day in, day out, people suffer from health costs of this state of thing. Where does it come from, in your opinion?
Ja się zgadzam, że edukacja
I do agree that education is of supreme importance, along with increasing the role of NGOs, smoke alarms, operating in several cities in Poland. It has been very important for increasing the significance of the problem. As I understand it, and I can see it in our public debate as well, even if the topic is not mentioned as the first one by everybody, this is an extremely important topic for the society. I am absolutely convinced that the awareness has been increasing. However, in the course of the discussions, we combine the issues related to air quality and the climate. I think that this is not that important. In both cases, we're following the right direction by means of the same activities. We'll be able to solve both issues, both problems. It seems to me that the awareness and the will to act has increased, and the Prime Minister Mateusz Morawiecki 2 years ago in his speech, in his expose, mentioned the issues related to air quality as the civilization challenge for Poland. The government has initiated a number of actions in this area. However, I have to admit that there is still a long way to go before we get the right quality of air. Still, I think that the first harbingers of the programs can be observed, and they are positive. The monitoring which we carry out to measure dust concentration levels, we can see it. We can see that the programs bring measurable results. We can see the reduction of specific substances owing to these programs. So I can say that the progress is evident. Coming back to the issue mentioned by Ms. Piszczatowska in reference to climate neutrality and Poland's joining the EU objectives, I always have difficulty talking about it because I feel I should make a disclaimer at the very beginning, and I have to explain where the objectives are prioritized. Just to make it clear, Poland, together with the member states in the amount of 27 at that time, supported the common objective for the EU of reaching the climate neutrality by 2050, and it happened in December last year, and it was unanimously approved by all member states. In the same conclusions, it was decided that Poland would need a longer time for transformation, taking into account the starting point and how much coal there is in our energy mix, it is evident that the transformation of our power engineering energy system will take longer than in Sweden, where the zero emission energy system is already there.
Przed Polską jest,
The way for Poland to cover is definitely more difficult. It is potholed with difficulty and it is demanding, which is understood on the European level. When we talk about these issues and the need to ensure fair transformation, as well as adequate resources to create the prospects for development in the regions which will be struck by negative social consequences of the policy, we can see that it is understood and Poland is the main beneficiary of these solutions and funds. As for the quality of the air, there is still a lot more to do, but I am very happy to say that since I have been dealing with the issue,
zdecydowanych działań.
we have moved on to more decisive activities related to clean air initiatives. They are not only related or limited to educational aspects, but also to such solutions as replacement of boilers. The rate of the implementation differs depending on cities, on regions, on towns. I do agree with the professor. In the areas where local governments are more involved, where they help their inhabitants to fill the applications, there are more projects implemented, and this translates onto the involvement on the local level. Thank you very much. I think that in Poland, we unnecessarily follow the conviction that the more coal we have in the energy mix, the more time we'll need for the transformation of the energy mix. However, taking this...
Także będziemy musieli działać dużo szybciej niż dzisiejsze plany rządu by to wskazywały, ze względu nawet nie na troskę o zdrowie i klimat, tylko po prostu na kwestie techniczne. Jednocześnie może...
Not only this, but also technical questions. Taking care of the participants of our discussion, I'd like to explain one lexical question. Climate and climate impact on health are results of extreme weather phenomena, for example, heat waves, that impact elderly people. Smog and low altitude emissions is not exactly the same as climate change, but on the other hand, incineration of coal in home boilers relates to people's health very much. And this is the degree that was described by Professor MD. He was quoting facts and figures and life expectancy related to the latter. But these things permeate one another, especially when we speak about Poland's energy policy, because the actions related to air quality improvement in Polish cities is also part of this document. Anna Stauter, the question goes to you. Speaking about energy transformation, we very often speak about costs, and this is Polish points of view, costs that you need to bear in order to become independent of coal. Do I understand it well, that there are also certain costs of sticking to coal, of continuous use of the coal? Briefly speaking, how much does it cost Europe to use coal, to carry on using coal? What's the cost for Europe with this regard?
Thank you for the question. And the question of costs is not one that we hear only from Poland. I think it's a question that is relevant for all EU member states, or anywhere where the discussion is happening. And what I've seen from my experience and from the many conversations I've had is that this cost argument is usually very limited, unfortunately, and it's talking about the costs, to industry, to sector. And the cost of measures, and this actually leaves out the unfortunate high health costs and impacts that we have seen from the burning of coal, or more broadly from the use of fossil fuels. As the fossils, when you burn fossil fuels, not only you have the contribution and the fueling of climate change, but you also have a large release of air pollution. And looking now more specifically at Polish coal power generation, so the burning that's taking place in so-called high stack. Unfortunately, what we see that the Polish coal power plants are among the top, the top plants for health impacts and costs in the EU. And you can do assessments on these health costs, and we've done several of them. And we're talking here about costs in the billions. So the latest analysis that we have done is for the year 2016, where we've seen health costs of Polish coal power plants of 7.5 billion euros a year. And that is not only to costs to the health of Polish people, but this is because air pollution travels. This is also to people in the whole of the European region. And unfortunately, Poland is also home to the most health problematic coal plant again for the EU, and that is Bełchatów, where we've also seen staggering health impacts from the burning of coal there. And I think one thing that is not enough, in people's minds there is the huge amount of mercury that is being released from coal power plants, and including from Bełchatów and other plants. And mercury that is, a highly toxic substance that's being released in the air, but ultimately it ends up in our rivers, it ends up in our fish, and it ultimately ends up in our bodies. And we have, really important science coming up on how mercury harms children's healthy development, and it actually harms the potential of children, or it limits the potential of children to develop their full abilities and to really contribute to society, and it leads to a loss in IQ points. And you may think this is, for one child, this may not necessarily be a lot, but then over a whole population, the loss, this loss of IQ points then also translate into significant economic losses. So I think there's a whole range of health costs associated with Polish coal power generation that needs to be factored in as these external costs that really needs to be factored in the debates that we're having.
Bardzo dziękuję. Teraz pytanie do pana profesora.
Thank you very much. Professor Zielonka, this question goes to you. What's your assessment of health costs? Because Polish health services are not financed. Especially from the point of view of COVID-19. We don't know the costs. We are poor at cost calculating. And this is a serious problem of Poland's medicine, because we are used to direct cost cutting without including indirect costs. British papers made us aware in the first months of lockdown what happened in this large-scale experiment when fossil fuels and road transport pollutions were limited. There was a clear decline, especially in the cities. Look and see, not only does it translate to 4,000 deaths fewer only in April. There were thousands of doctors' meetings fewer, hundreds of fewer people in hospitals. less medication was bought because cardiovascular diseases did not aggravate. So it was a side effect of a lockdown. So if we calculated the incomes, and the income was not calculated, it was only Great Britain that developed this kind of paper. But in Poland, we didn't calculate the number of doctors' meetings, medications, visits at an ENI, and deaths. And this is a very important result. So it would be profitable to calculate what happened in the first part of the pandemics, when lockdown resulted in large improvement of the air quality. It translated to health benefits. In April, 4,000 deaths fewer, despite COVID-related deaths. In October, there was the increase of few thousand, of dozens of thousands, because there is a poorer air quality. I'm fully convinced that some of the COVID-related deaths, and there are many of them, and there are too many compared to the number of infections, because this is alarming to see this great number of deaths. Look and see. This high number of deaths might be related to poorer air quality. We've seen it in Italy. It was Lombardia, Padova. It was a strong correlation between air pollution and the number of aggravated cases that ended up in ENVI and resulted in deaths. November deaths might be related to poorer air quality. If there are poorer conditions, if it gets colder, January and February may bring about greater COVID problems, because it has a negative impact on general healthcare and comorbidities in COVID. We are one of the countries that has recorded the greatest number of deaths in Europe. This may be associated with poorer air quality compared to other European Union countries. However, we have not tested this correlation. Yes, there are problems of healthcare service. They are in place. But in today's debate, we have been speaking about heat level records. We are not discussing the fact that Polish hospitals are in debt, that they barely make two ends meet. Polish hospitals do not have this kind of standard that is in place in other European countries, that is air conditioning. So patients suffer a lot, especially during summer when there is less air pollution. It is a direct impact of the climate on Polish hospital patients. They suffer from heat, thirst, and shortages of the personnel. There is nobody to give them water. So this means quite a costly situation that brings about unwanted results. People need to be supplemented with water. It is administered through ENVI. So if we had air conditioning, people suffering, people with infections, people with fevers, there is 30 plus temperature in the room. Hospitals cannot afford it. If Polish hospitals run into debts of millions of Polish zlotys, so air conditioning in hospital rooms is last on the investment list. So the climatic changes expressed by temperature level have a very negative impact on people. They suffer. I cannot help people who suffer from heat in unconditioned room. They have different comorbidities. People suffer all year long. The conditions in summer are especially difficult for the ill people. We don't have any compassion for them. We keep talking about different needs, but we cannot see that it's worth putting air conditioning in patients' room. I'm not speaking on behalf of doctors or nurses. May people have air conditioning. I can escape the hospital, but they are bedridden. We don't have this social awareness. There are specific wards of, for example, intensive care wards that have air conditioning in. Most of the Polish patients suffer when there is 30 plus degrees heat in a hospital. So this is undesired suffering. Can't we afford improvement? Hospitals cannot do it because they choose what to pay for first. So air conditioning seems to be an extra expenditure, but the state may afford to help the ill. It is not the hospital, not the personnel, but the ill that should be helped because they suffer in 30 plus degrees centigrade. Some of the rooms are poorly ventilated, so the situation is unbearable. I have observed the number of deaths in hospitals, especially in smoke period and heat wave period. There are two situations. Summer does not mean improvement of health because there is less purity, but the heat wave makes elderly people suffer a lot because of dehydration and high temperatures in our hospitals.
Bardzo dziękuję. No,
Thank
sytuacja
you
jest
very much. As we can see, the situation is difficult. We have lots of evidence confirming that the situation in Poland is difficult. I can't see Mr. Pascal Canfin among our panelists. I'm afraid he might have had some technical problems. So I think we should move on to the more positive part of our discussion, and we'll be talking about how quickly we could move from discussing the problem to the point when we implement some solutions and what are the best practices that have been implemented in Europe so far. Anna, could you please tell us about such examples from other countries, examples of good practices that rendered good results in relation to health protection, which could be inspiration for Poland or example to follow?
I think what has become clear from what we heard before is the huge prevention opportunity we have through ambitious and decisive climate and energy measures going in the right direction, because we've heard about the significant or the huge health costs. We've just heard the strain that we've seen on Polish hospitals. I think under that perspective, it's a bit changing the perspective of what are we trying to achieve with our climate and energy policies. We're trying to tackle climate change, but what we're also really trying is help alleviate the load that we're seeing on the Polish healthcare system and on people suffering. I mean, that's the other aspect that's also a clear moral and ethical aspect, and that's very hard to value. That can be valued, but it's people suffering. It's those kids who can't go to school because they have really bad asthma on certain days, or parents having to think, which way will I go? Which will I take my kid to school? Should I even go out on certain days when there are high smoke levels, or should I stay inside? All these kind of worries and suffering that we're seeing. So I think this is something I'd really like to underline. It's about preventing. It's about preventing people dying early. It's about preventing cases of cancer, cases of heart disease, cases of lung problems, all of which are costing not only the Polish economy dearly, but all the economies across Europe. And in that sense, a good example I want to give is actually from the health sector themselves, is that we've really seen an increased number of doctors, of patients, of public health experts being active on this issue. And I think with the with the COVID pandemic again. It's a terrible tragedy, and it's something unprecedented. But I think if it's one thing that it's shown us, it's how important our health is, and that we really should strive to do all that we can to protect people's health, and to think about the future also, and kind of how do we get our overall population more resilient? How do we make them more healthy, so that when the next pandemic hits, we are better prepared in a sense. And this is how actually swifter transformation in the energy sector, and how stepping up on climate commitments can help ultimately with the better health of the population.
Bardzo dziękuję. Panie ministrze, pytanie mam takie do pana.
Thank you very much. Now I have the question to the Secretary of State. Taking into account the coronavirus situation, which will definitely emboss its trace in the future situation of Poland globally, don't you suspect that we'll have to consider modification of our plans in order to include the influence of small and medium energy sources, their impact on the health of our population? Thank you very much for your question. I think it is very important, as you rightly pointed out. I have already mentioned that we combine the issues related to air quality and climate. I think this is important to understand what factors are of supreme significance for the improvement of air
Słuchaczy utrwalił przekonanie, że właśnie te małe źródła są istotne. Nie, one są najbardziej istotne. 3/4 naszego
our energy sources are not important because they are.
To są te wszystkie stare, nieefektywne piecyki w 3,5 miliona polskich gospodarstw domowych, które palą węglem czy paliwami jeszcze gorszej jakości i są, tak jak powiedziałem, źródłem ogromnej większości naszych emisji pyłów i innych zanieczyszczeń do powietrza.
Which are based on lower quality of flue gas and exhaust. This is important for us if we want to improve the quality of air in Poland. That is why we need to replace the old heaters, the boilers. I do agree with the professor that some cities or towns in Poland delay their modernization of their municipal housings, where there are lots of such sources, while other ones, such as Krakow, take more decisive measures. As for the quality of the air, the minor resources are important, and this is where our efforts, our endeavors focus. They consist of several dimensions, but let me enumerate the key aspects only. Some decisions and some measures are taken on the level of local governments. They can define in their air protection plans the measures which they intend to undertake, including quality standards for fuels used for heating. Furthermore, some local governments, cities or towns use it in Poland. I think in 13 regions have already submitted their plans. Some of these plans have already been evaluated, while others are being evaluated. Some Polish cities and towns have implemented limitations related to fuels as well as their local transport. These are
duża część wyzwania.
activities and operations that are very important on the level of local governments.
Jest pewna rola, jeżeli chodzi o
The
legislację.
government as well has its important legislative role, and we are developing new measures that can be implemented in this respect. However, we are supporting the transformation using the cohesion fund as well as our local funds, local national fund for the clean air, to provide the opportunity to replace the old boilers in individual households. It already has amounted to 3 billion zlotys spent. However, some redemptions for thermal upgrading, the expenditure related to modernization of households were limited.
Że kolejne 3 miliardy złotych
We have also
inwestycji zostało zrealizowane, więc
learned that more investments of the similar kind have been implemented. This is the key direction that we have set for our operations. I can definitely say that we will develop further legislative initiatives to implement the assumptions of our policy. Thank you very much. Now I would like to ask the questions that our audience has submitted. The list of questions is long, so I think we'll have just enough time to ask them. The first question goes to Mr. Guibourgé-Czetwertyński. It is asked by Dominika Lasota from the Youth Climate Strike. I would like to ask the Minister, what is the opinion of the Ministry of Climate towards the currently proposed objective related to reduction by 55% by 2030 in the whole European Union? From our perspective, the key aspect of the discussion on the EU level in relation to the emission reduction is to decide whether we have the tool, the instrument to execute the objective. Very often we tend to boast about high ambitions. However, if these ambitions are not followed by specific measures that facilitate implementing the measures, and if they are only in paper, it will definitely not contribute to solving the problem. For us, it is of key importance to provide instruments on the EU level. It is not only through providing appropriate legislation and establishing the standards for some sectors or determination of particular objectives. It can also be the tool for some sectors to use. However, we would also like to mobilize adequate financial measures for the investments. The European Commission has developed a plan of sustainable financing amounting to 1,000 billion euro in the upcoming decade for climate investments. This is a huge amount, but this is only 1/4 of what we need to reach the new objectives proposed by the European Commission. So definitely we need to have more details, and we need to feel we are ready to take such measures that will help us reach such ambitious objectives?
Thank you very much. And the second question goes to Minister too. What is Poland's standpoint with regards European Commission's view regarding the weakening these joint attempts and joining transport into trading systems regarding emissions? Do you see the risk of this market tool for the sector, which may translate into fuel increase? And won't it make the citizens poorer? I believe that the question itself indicates one or even two main problems. These are the problems that I'm seeing in this kind of attitude. The Green Deal, all the announcements ever since it was presented, this included one of the Commission's proposals. This was discussed in the Parliament, in NGOs. They expressed our skepticism. I can see two main problems related to this idea. First, the question related to efficiency of this kind of action. Not necessarily am I convinced that this kind of expansion of PTS to include transport sector or the buildings infrastructure sector, would be the efficient tool to reduce emissions in the above-mentioned sector. And the second element that was suggested in the question, social consequences of this kind of policy. I believe that, especially in this era of economic crisis that was triggered by coronavirus pandemics, our policy should not create any further burden, especially for the poorest ones, for those most exposed to this situation. Certainly, this is the element that should be taken into consideration when designing this kind of policy. So there are two reasons for my skepticism with relation to this idea. Thank you very much. Minister, it comes as no surprise that the third question goes to you too. In the meantime, there was a question related to activities of central level government to improve the quality of air in the years to come, but we believe we have exhausted this topic. There's one more question. It's interesting. I'd like to ask about Polish government's plans to limit fossil fuels prospering. In 2019, we opened up Bzie coal mine, and we haven't heard about plan changes with regards other coal mine. Opening up of another coal mine was announced by Grzegorz Tobiszowski in March 2019. So what are the plans with regards coal mining in Poland? The Ministry of Climate and Environment, well, it's hard for me to discuss the question of coal mines because coal mines report to the Ministry of State Assets in Poland. As you know, Polish government has signed the agreement with the representatives of Polish mining group trade unions. This initial agreement stipulates closing down the last coal mine in 2049. So there is an ongoing discussion and work in task forces about details of the agreement. As of today, it would be hard for me to say what is the schedule. On the one hand, this is a social aspect of the issue. On the other hand, there is a specific reality that we are facing, technical reality that has already been mentioned in the course of our discussion. Most of our Polish energy blocks are about to finish their life service. 70+% of them are 30 years plus. They will have to be replaced. Therefore, our energy policy has stipulated the construction of emission-free based energy system. This is nuclear power and RESs that make it possible to develop comparable system like 40 gigawatts by 2040. So this is the path to go along. This path is the resultant of externalities that also considers them, like access and prices of materials, CO2 prices and climate policies, and so on and so forth. Thank you very much, sir. I'm checking whether my mic is on. A punchline question. It goes to all panelists, starting with Minister again. Do you agree with this direction? Poland should give up on fossil fuels as fast as possible and either step back or slow down the investments in gas energy sector. Poland should give up on fossil fuels, yes or no? I'd say this is the conclusion, but it shouldn't be the only assumption.
Te wszystkie czynniki, o których mówiłem już wcześniej.
Having considered all the factors that were mentioned before, I'm not going to reverberate them, but the factors, the reality we live in, poses the question how to shape energy policy in order to secure long-term and safe supplies of electricity with the lowest possible emissions level. If we were able to do it having fossil fuels at hand, whilst meeting all the requirements with regards cost and air quality. The conclusion of the analysis based on the data that we have and potentials analysis with regards RESs and technology costs and other technology costs was carried out whilst preparing the energy policy. And the conclusion is zero emission system should be based on nuclear energy and RESs. But we shouldn't have this kind of upfront assumption. It should be a conclusion that stems out from analysis. The role of the gas in the process. Natural gas might be used for interim period because it is the source of emissions all time. So if we want to meet Polish obligations, a party to Paris Treaty, it cannot be a solution in a long-term perspective.
W krótkim horyzoncie to będzie istotne paliwo cały czas.
Short term, it will be an important fuel. We need to work on solutions that make it possible to decarbonize. We might use biomethanes or hydrogen that is acquired from emissions-free processes of generation.
To powinno być więc też kierunek naszych wysiłków.
This should be investment directions.
Ale też dla tych problemów zdrowotnych, dla jakości powietrza, gaz będzie
We need to consider health problems and heat generation. Gas will play a role in heat generation because in many places no other technology will be available so that we can generate heat in a way that produces fewer emissions. Thank you very much. Professor, your point of view. You are a health specialist. Should Poland give up on fossil fuels quickly, or is it of lesser importance? How to do it is a problem, not if. What is very important to attain the goal is to integrate dispersed activities we are facing. We've been speaking about some of these, like education. But education is not enough. It doesn't bring about any problem. It's not enough to have a program if we don't have education or general awareness. There is the medical, economic element question and the social problem. This is what the minister was speaking about. At some point, we need to realize what kind of support should be exercised to those who cannot afford the transformation cost. We need to be ready for that. This is multi-point, multi-threat program. Many areas are involved. There were positive elements in the discussion. Program financing, awareness increase. The most important program is how to integrate dispersed activities in Poland. We could hope that the ministry and the minister would deliver that, because hardly can we imagine any other body to integrate energy, educational and health activities. We need to improve education at schools. Media, medical awareness also require improvement. This is multifaceted activity. Who is missing is a coordinator in Poland that analyzes initiatives of different ministries and milieus from the point of view of the climate change. If we have decided to create a new ministry, something that we've never had before, is the token of recognition to the problems from the state authorities. But this ministry should play this missing role of an integrator of dispersed activities. Too much effort is wasted because it is devoid of support. It's important to integrate activities so that medical, economic endeavors, energy needs, social needs, it is all integrated. It is brought together and mutually supported. Unless we have integration, the results will be smaller than our endeavors. There's a lack of integration. The Minister of Climate, wouldn't you like to be the integrator of different milieu's activities? Devoid of this, it will be harder for us to attain the goals. We need to orchestrate financing needs, meeting needs, social attitudes. I do realize that it's easy to talk about limitation of coal excavation Pomerania region and a horse of a different color when you go to Silesia and talk about it. So the problems that we are facing should be solved, but what is missing is action integration. This is my appeal. This is home take message from this debate. Bring forces together. Representatives of different milieus were speaking at this conference. NGOs, medias, medical world, central level authorities, European Parliament. Let's integrate the activities because every representative has demonstrated a great involvement. If we act together, effects will be better.
Pani Anno, czy mogę Panią prosić o
Thank you.
komentarz?
Anna, could you comment on it?
Thank you. I want to say that the reliance on fossil fuels has brought great prosperity and wealth and economic growth, not only for Poland but for Europe as a whole. But ever since we've continued to rely on this the production and combustion of fossils, this has come with a huge health bill, with a huge environmental bill that all of us have been asked to shoulders, and it's simply it's an unacceptable cost, and this is why we do need to move out of fossil fuels as soon as possible, and the alternatives are there. It's not that we don't have a choice. We have the alternatives, and I wanted to underline again, and this would be my wish from this debate, how important it is to actually aim high and step up, and also for Poland to step up, and for the decision in 2 weeks' time to really support a higher 2030 goal as a recognition of the science, a recognition of the urgency to act, and a recognition that it's ultimately climate and energy policies. It's about protecting people's health. And so it would be a demonstrable commitment that we want people to live healthier and we want to have a healthier future. And this is a way to achieve it.
Bardzo dziękuję. Szanowni Państwo,
Thank you very much for your discussion. We would like to live, as Anna Stauffer said, we want to live healthier, better. However, we need to work towards achieving all these objectives. One of these measures is social compromise that still needs to be developed in Poland. I would like to thank the Minister Guibourgé-Czetwertyński and Stauffer. Thank you very much. Professor Tadeusz Zielonka, thank you for a very important message in this discussion. I would like to give the floor to Veronika from Hill, who will close the discussion. Ladies and gentlemen, thank you very much for participating in the discussion. We were honored to have you here virtually and listen to your opinions. I would like to thank all the participants. Both English and Polish version of the recording of today's debate will be available on our website. We would like to thank our interpreters, Sonia Derzycka, Paweł Kozłowski. Have a nice day, and I hope that you will join us during our next webinars, and we'll all towards better and healthier world. Thank you very much, and goodbye.